Hi, I'm Amy Catalucci, and our group did neural tube defects, specifically spina bifida. So we're going to review the neural tube formation. This happens 18 to 23 days gestational period. On the 18th day, the neural plate and spinal column form. On the 20th day, the neural plate folds and the neural groove develops, along with the hemispheres developing in the brain. On the 23rd day, the brain and neural tube have formed. Coordination between the non-neural ectoderm and mesoderm is critical for neurulation. Ectoderm is a layer of cells responsible for the nervous system and skin development, while the mesoderm is a layer of cells responsible for the skeletal and muscle development. The endoderm is a layer of cells responsible for the lining of internal organs, which is also known as the viscera. This occurs only 3 weeks after conception.
Neural tube defects are spinal and brain birth defects. They happen after the first month when the neural tube does not fully close towards the caudal end. They can cause serious side effects or even death. Similar to many other disorders, it is not known what causes neural tube defects, but if you had a previous child with an NTD, or you or someone in your family has an NTD, you can have a high risk of having a child with an NTD. And then two of the most common ones are spina bifida and anencephaly.
Spina bifida is when the rostral area of the neural tube doesn't close. This leads to the exposure or unexposed bump of the quada equina. Anencephaly is when the caudal area of the neural tube fails to close. This leads to no brain development. This spina bifida anencephaly occurs in 1 out of 500 live births, and is more common when the mothers are not aware that they are pregnant and when they have low folic acid levels.
So spina bifida is a condition that affects the spinal cord and is noticeable at birth for most types, and spina bifida happens during the first few weeks of pregnancy. It happens anywhere along the spine if the neural tube does not close as it should, and since the neural tube doesn't close all the way, the backbone that protects the spinal cord doesn't form and close as it should. Due to the neural tube not closing, the spinal cord and nerves are damaged, and this can cause physical and intellectual disabilities that range from mild to severe. And the severity of spina bifida depends on size and location of opening in the spine and whether part of the spinal cord or nerves are affected. And then we have our three most common types.
So for the incidence, it occurs in 10% of the population, happens in approximately 1 in 700 births, and abnormalities are evident at birth. Prognosis means how the disease progresses. Most children with the disorder have normal intelligence and can walk, often with assisted devices. If learning problems develop, appropriate educational interventions are helpful. If needed, surgery can correct the problem. Later in life, more loss in function, orthopedic bone problems, and foot and ankle deformities. Okay, so we're going to go to etiology/causes for spina bifida. Like Sophia said earlier, there's no known causes for spina bifida, but there's lots of risk factors that increase the likelihood. Most of these, if not all, happen in utero when the mother has some sort of disease or unhealthy habit. One of these risk factors is if the mother has diabetes. The increase in blood sugars is not good for the baby in utero. If the mother is medically diagnosed as obese, there's a link between obesity and neural tube defects that is unclear, but poor eating habits have contributed to spina bifida throughout statistics. If the mother has chronic seizure disorders, they usually take drugs such as anticonvulsants. This drug blocks the body's ability to process folic acid, which is one of the most important drugs that the baby needs for development. With the mother having high body temperatures during pregnancy, this can include her having the flu, being sick, or even sitting in a hot tub or a bathtub that increases her temperature by 3 or 4 degrees. That's a high risk factor for the child developing spina bifida. And if the mother has an unhealthy diet, folic acid might not be getting to the baby, which is vitamin B9. And like I said before, it's an important vitamin in the development of the child. A lack of this increases the risk for spina bifida, and to increase it, the mother can eat cereal grain products, And basically, if the mother has lower socioeconomic status, this is pretty straightforward for any disease that could, because they won't be able to afford drugs or medical help.
There are a few different ways to diagnose spina bifida, such as a maternal serum alpha-fetoprotein test, which is a blood test performed on the mother that confirms high levels of AFP. Also, you can do ultrasounds or amniocentesis. To treat spina bifida, you can have surgery before or after birth, a C-section, or walking and mobility aids, bowel or bladder management, and surgery for hydrocephalus.
So those specific classifications for spina bifida, there are 4 types of spina bifida. The first one is occulta, which is the most common form in which one or more vertebrae are malformed. The second one is the closed neural tube defects, and that is a group of defects in which the spinal cord is marked by malformations of fat bone or meninges. The third one is meningoencephaly, which is a spinal fluid and meninges protrude through the abnormal vertebral opening. And then the last one is myelomeningocele, and that is the most severe and occurs when the spinal cord is exposed through the opening in the spine, resulting in partial or complete paralysis.
3 minutes and 53 seconds.
And then, all right, so secondary characteristics of spina bifida, symptoms people may experience, which is gastrointestinal issues, and an example of that could be like bowel obstruction or constipation. There's muscular problems, which could be muscle weakness. There's marks on the skin, which could be birthmarks or like a synscus. And then urinary problems could be shown as like bedwetting or a leak of urine.
Okay, so now we're going to talk about the medical implications. So medical implications are a possible future effect or result. So I'm going to just go over the long-term effects. And each effect will depend on how severe the condition is. But basically, there could be walking and mobility problems, causing muscle weaknesses of the legs, and sometimes involving paralysis. There could be orthopedic complications. Children with myelomeningocele can have a variety of problems in the legs and the spine because of weak muscles. There can be bowel and bladder problems. So the nerves that supply the bladder and bowels usually don't properly work because the nerves that supply that come from the lowest level of the spinal cord. And then there could be accumulation of fluid in the brain, which we know as hydrocephalus. Shunt malfunction. So in medicine, a shunt is a hole or a small passage which moves or allows movement of fluid from one part of the body to another, and then the shunts can stop working or become infected. Chiari malformation, type 2, is a common brain abnormality in children with spina bifida. And then meningitis, which is an infection in the tissues surrounding the brain, sleep disordered breathing, and a tethered spinal cord.
OTs can help patients with spina bifida by monitoring their child's developmental milestones, then provide suggestions regarding what they can do to help your child to reach those milestones. For example, OTs can help these patients learn how to move, develop sensory abilities, and thinking skills. They can also give these patients equipment like a wheelchair if needed. They also assist your child in being as independent as possible by doing ADLs with them. OTs can also do home visits if anything else needs to be modified so that the child can do the things for themselves. And these are our references.
There's also a video. It's not on here, but we'll either tell you about it in class or share the website with you. But it's about a little boy with spina bifida. Thanks for watching.